everybody, welcome to my channel. In this video, we'll talk about the course of facial nerve. Facial nerve is a mixed nerve, that is, it has both motor and sensory components. Let's first have a look at the nuclei of facial nerve. This that I've marked in red is the principal nucleus or the motor nucleus of the seventh nerve. It belongs to the special visceral efferent neural column. The fibers originate from here and then they wind around or go around the nucleus of the sixth cranial nerve, and then they go forwards and exit from the brainstem at the pontomedullary junction, where they lie lateral to the fibers of the sixth cranial nerve or the abducent nerve. Now, while hooking around from here, they also raise a bump in the floor of the fourth ventricle, which is also known as as you can look here, it is known as the facial colliculus. Now, these fibers are the motor fibers which supply the muscles of facial expression. Now, these muscles are derived from the second pharyngeal or the branchial arch. That is why these fibers can also be called the branchiomotor fibers. And this nerve is called the facial nerve proper, or the motor part of the facial nerve. Now, facial nerve also has some parasympathetic secretomotor fibers that are responsible for lacrimation and salivation. They arise from the superior salivatory nucleus, which belongs to the general visceral efferent neural column. Now, if there's a superior salivatory nucleus, there's also an inferior salivatory nucleus, right? The superior salivatory nucleus is associated with secretions from the submandibular and the sublingual salivary glands, and it is associated with the seventh cranial nerve, while the inferior salivatory nucleus causes salivation of the parotid gland, and it is associated with the ninth cranial nerve. The superior one is also associated with lacrimation, while the inferior one is not. So a hint to remember it stands for SSSS. The superior one is associated with sore eyes, S for sore eyes, and sore eyes, as we know, are associated with lacrimation, crying, right? Now, coming on to the next sort of fibers, these are the taste fibers which are drawn in pink. The facial nerve carries taste sensations from the anterior two-thirds of the tongue, and ultimately they go to the nucleus of tractus solitarius, NTS, for which I've represented it with a tractor. Now, this NTS nucleus belongs to the special visceral afferent neural column. How can we remember this? If you know, there were a cartoon character called Swat Cats. So the SVA stands for SVA column, and T stands for taste. And the Swat Cat is driving the tractor, so nucleus of tractus solitarius. Now, the next sort of sensations are the general somatic sensations, or the general somatic afferent fibers that carry sensations of touch, pain and temperature from the external ear and the external auditory canal. Now, these sensations are then they go to the spinal nucleus of the trigeminal nerve, which belongs to the general somatic afferent neural column. Now, the red one was the motor nerve or the facial nerve proper. Other than that, all the three fibers together are called the sensory root, or the nervus intermedius, or the nerve of Risberg. Although it is the sensory root, but it has some motor fibers. So that's something that is baffling, and I wanted to draw your attention towards it. Now, we will discuss about the course of the facial nerve. So these are the four nuclei of the facial nerve which lie in the brainstem. This is the principal motor nucleus, and fibers from here we already studied that wind about the cranial nerve nuclei of the sixth cranial nerve nuclei, and then they exit from the pontomedullary junction, and then they go in the petrous part of the temporal bone through the internal acoustic meatus. They go forwards and then enter the middle ear cavity. This cube is the middle ear cavity. They take a sharp turn and then go horizontally backwards in the medial wall of the middle ear, forming this bend is called genu. So here geniculate ganglion also is present. Then they go horizontally backwards, lying between the lateral semicircular canal upwards and the oval window downwards, and then they again make a turn and go vertically downwards in the posterior wall of the middle ear, and then they make an exit from the cranial cavity through this foramen, which is the stylomastoid foramen. Why? Because it lies between the styloid process anteriorly and the mastoid process posteriorly. These fibers exit from here and then they give off branches, ultimately reaching the parotid. So the course of the facial nerve is actually from the pons to the parotid gland. Now we'll have a look at all the branches in detail. So the first branch is given off here at the level of the geniculate ganglion, which is the greater petrosal nerve. Now this nerve carries the parasympathetic secretomotor fibers. How? Because these fibers, which I've demarcated in the color green, arise from the superior salivatory nucleus, right? They travel to here, and from here this nerve is given off, greater petrosal nerve. It enters the middle cranial fossa and then goes into the foramen lacerum, where it meets this other nerve. This other nerve is called the deep petrosal nerve, which actually arises from the sympathetic plexus around the internal carotid artery. They together pass to this canal, which is the pterygoid canal. So together this nerve is known as the nerve of pterygoid canal, also known as Vidian's nerve. Now from this pterygoid canal they enter this fossa, which is the pterygopalatine fossa, which houses this ganglion, which is of course known as the pterygopalatine ganglion. These fibers, the deep petrosal nerve fibers, just pass from the ganglion, while the greater petrosal nerve relays here, and the postganglionic fibers then are carried in the zygomatic branch of the maxillary nerve, and then the information travels in the lacrimal nerve, which is a branch of the ophthalmic nerve, and ultimately reach the lacrimal glands. So that is how greater petrosal nerve is ultimately responsible for lacrimation. It also gives secretion information to the nasal and the palatine glands. Now let's look at the second branch. Now the second branch is given at the level of the second genu, which is the nerve to stapedius. The nerve to stapedius, as the name suggests, causes contraction of the stapedius muscle. Stapedius muscle is the muscle that is attached to the stapes, and it is responsible for pulling the stapes out of the oval window, thus protecting our ear from loud sounds, which is known as the stapedial reflex. Now coming on to the third branch. Now third branch is given in the middle of the vertical segment, which is the cauda tympani nerve. The cauda tympani nerve lies just medial to the tympanic membrane, passes between the incus and the neck of the malleus, goes forwards, exits from the middle ear cavity through the petrotympanic fissure, and then what it does is it is responsible for two things. Now I've drawn these fibers in two colors. The green fibers are responsible for secretion from the submandibular and the sublingual glands. So these are the GVE fibers, and it also has some pink fibers. What have we represented with pink? The TACE fibers, the SVA fibers. So it is responsible for two things. First, let's look at the green component of the GVE component. These fibers go along the lingual nerve, relay here, and then the postganglionic fibers are responsible for secretions from the submandibular and the sublingual glands. Now let's have a look at the TACE pathway. So from here, TACE fibers are the ones that are drawn in pink. The taste sensation goes along the lingual nerve, then it goes along the cauda tympani nerve, then goes back to the nucleus of Tractus solitarius. Now I've drawn the NTS like a tongue, but does it have such shape? No. It is actually a U-shaped nucleus where its rostral part is responsible for gustation or taste. Okay. Now let's have a look at the orange fibers. Orange fibers are the ones that are responsible for general somatic sensations of touch, pain and temperature. So they travel to the post-auricular nerve, then travel along the facial nerve and go to the spinal nucleus of trigeminal nerve. Now, after exiting from the stylomastoid foramen, facial nerve gives some branches like the post-auricular nerve. This is a motor nerve which gives supply to the occipital belly of occipitofrontalis muscle. It also gives branches for the stylohyoid muscle and the posterior belly of digastric. And ultimately, it goes anterolaterally towards the parotid, divides in the substance of the parotid into its peripheral branches, which are the temporal, zygomatic, buccal, marginal mandibular, and cervical. This arrangement is also known as the pes anserinus or goose foot because it resembles it. So that was all about the course of the facial nerve. Hopefully you liked it. If you like this video, please like, share, comment and subscribe to my channel. I'll see you in my next video. Thank you so much for watching.